For those of you sitting here, we're just waiting for hard copies of the bill itself, and we'll be starting momentarily. Thank you for your patience.
Okay, so there's 2 Senate hearings.
Yeah, these are the 4.
Service things.
Yeah,
Okay,
that's-
that's what I'm missing.
I've got-
is one of those.
Here's the pile with all of them, and they're both there, so whichever one you don't
Thank you.
have, you can.
Confusing, very confusing.
There was a game at summer camp that was like that.
This shows you how invaluable Christina is. When she's homesick, we really miss her. And thank you for being here. This is the subcommittee on Senate Bill 236. It's a retained bill out of the Committee on Health and Human Services and Elderly Affairs. As stated in the bill itself, it's an act establishing a committee to study nonprofit organizations contracting with the Department of Health and Human Services for children's services. Is anyone here to speak on the bill, or does anyone want to comment? Representative Weber.
I think I'd very much like to talk among ourselves first, because this is not actually a public hearing, it's a public meeting. And what I wanted to say, just by introduction, is the bill is limited, not in its title, but in its body with respect to insurance coverage. And we had a great deal of very compelling testimony at the original hearing, which spoke to the difficulty that some organizations which provide much needed services in the state are having getting insurance coverage at a rate that they can afford. And they're supplying critical services usually to very vulnerable populations. So I will just state my own position. I don't know why we didn't just pass this and get the work started last term, but I have no objection to hearing from people, but it seems to me that if there is more to say, that's great, but I just don't want to sort of start the public hearing process all over again from square one.
Okay.
Thank you.
Thank you, Representative Weber. Any other committee members, subcommittee members want to comment before we hear from someone else? Okay. Okay, I'm sorry, you were about to come up. Please do.
Good morning.
Good morning.
My name's Emily Lawrence, and I am the Deputy Advocacy Director with Waypoint. And Waypoint was working with Senator Chanley on bringing this bill forward in result because of the concerns for our ISO foster care program. Waypoint runs a small ISO foster care program which provides wraparound services for children with some of the most intensive needs. These are some of our most vulnerable children involved in the child welfare system. And this service provides them with the opportunity to remain hopefully in their home communities or at least in their home state and get community-based services. It's an alternative to sending kids to residential facilities, which, as you may know, the state is really trying to move away from doing that and serve children in their own communities. Unfortunately, we've had issues, as that's why the bill came forward, with our insurance. We've lost our umbrella and policy. We currently do have $1 million liability policy. We know that in the unfortunate event that we were involved in a case, that sometimes those damages are much greater, and often entities will go after the nonprofits because the state has a cap. So it's not that they don't go after the state as well, but and so we did look around. We've had our broker looking for alternatives. We were able to get a quote from Berkshire Hathaway for our 8-bed program. It was double the cost of what we pay for the entirety of all of our other programs. So that's really not a sustainable, affordable option for us. And while we are a small program, we're one of many that will be affected by this. So unfortunately, we're afraid that it would be kind of like death by 1,000 cuts of these little programs that provide these really critical services. And as it is, we don't have enough of them in the state. As you may have seen, the Office of the Child Advocate's recent report on children that were sent to a residential facility in Tennessee, there were really unfortunate concerns with their care there, and we were lucky to bring them home. But the reason that they were sent there is that we can't find appropriate care in the state because we don't have that. And we are working on building it up, but it is these critical services that we need. We did meet with the insurance commissioner and his staff who are here to discuss this issue. We know this is something that they are looking at as well, and talking with some of the national entities looking at this issue. We are not opposed to different options. We just want to make sure that it is examined and we can figure out a solution to this. Because from a business perspective alone, it's not sustainable for us to continue. And as it is, the only insurer right now that insures these types of organizations is Philadelphia. As you all know, there is a large lawsuit against the Sununu Youth Services Center, and in that lawsuit, over 100 other entities have been named, and almost all of them have Philadelphia for their insurer. So the likelihood that Philadelphia may start pulling back, which they have done, I believe in New York, they've completely withdrawn from coverage of some of these programs, is real. And in that instance, there would be nothing for us. So, and we're required by the state to maintain insurance as well in order to do these contracted services.
Okay, thank you. Questions from committee members or comments?
That gave a good overview. Thank you.
Sure.
Okay, thank you.
Thank you so much for your time. Oh, I'll just share that last year in West Virginia, they passed a law that required all its child placing agencies, which when I read the definition would be akin to what Waypoint does, to maintain a $1 million or more insurance policy, no less than $1 million. And then they allowed, they were put in statute that they would have a limit of liability up to their insurance amount. So, yeah.
Sure, Representative Cushman.
What is can you tell me what umbrella coverage versus liability coverage
Yeah,
is?
I can tell you my limited knowledge. I'm not, so for example, we have liability coverage is your base coverage for issues. And then umbrella covers if it's going to go above that. So it's almost like an extra layer. And perhaps someone else could explain it better, but that's my understanding of it.
Thank you.
Any other questions for, sorry, ma'am, what was your last name?
It's Lawrence.
L-A-W?
Yep.
R-E-N-C-E?
Yes.
Okay, great. And Deputy Advocacy Director for Waypoint?
Yes.
Okay, excellent. Thank you.
Thank you.
Okay, thank you very much for being here this morning. Would either of you folks in the audience like to testify? I know you serve, you're from the Department of Insurance, and you gave us a letter from the Commissioner, but I don't know if you want to, elaborate on that at all, or?
Sure, I can elaborate on that. My name is James Fox. I'm the Property and Casualty Director at the New Hampshire Insurance Department. This is Emily Doherty. She's the Property and Casualty Attorney at the department. As to your question about umbrella insurance, like if you have a homeowner's policy, that's your primary layer of insurance. And then if you have assets, you want to protect assets above what they'll sell you as a primary layer. So then you buy an umbrella layer, and that basically is an umbrella over all of your coverages that you have. So it's just it's a higher level, higher layer of insurance. So it kicks in at like the $1 million level, or where yours, whatever you buy, and it's usually cheaper. So people usually do buy an umbrella policy. As to the bill, the department has also looked at the issue of nonprofits' ability to purchase insurance. As a general matter, the markets are hardening, which means it's harder to get insurance. It has a lot to do with property losses across the country, and then reinsurers pulling back from having reinsurance. And if you know, the frontline insurers are, the ones Amica, those companies. And then above that are the reinsurers who basically insure the insurance companies. And so there's less reinsurance out there, so there's less capacity to sell. So then ultimately the market hardens, so it's harder to find coverages. Now, in some areas, we're not as worried about that, but I know the commissioner in this particular area for nonprofits, due to the critical services they provide, he is concerned about it. And he is committed to attempting to find a solution by working with all the stakeholders. If there is a subcommittee, we absolutely would be here to support the subcommittee and provide as much information as we can. So we did submit a letter, which are the actual commissioner's words. So I would rely on that letter, but I would say the department is 100% not opposed to this, and we would be an active participant in the subcommittee to try to find a solution that works for everyone from industry to the nonprofits.
Sure. The commissioner's comment is basically sounds supportive of the concept. He said that I do believe it would be beneficial to have a structured group of stakeholders and policymakers to join us to form a strategy to move forward. So I think
Yes.
that says a lot.
Correct.
Any questions from committee members? Okay.
Thank you.
Well, thank you very much for being here. Thank you for this letter and the information.
Yep.
Representative Weber.
I just had a comment based on all of that. I see no problem with the bill as drafted. I think that one of the things we might want to suggest to the speaker is that in appointing the two members of the House of Representatives, I would very much hope that one of them came from the Commerce Committee, which has a great deal more experience with insurance issues. And I frankly have no idea why this bill came to us, because the underlying issue of children's services tend to go to the Children and Family Law Committee. So if there was to be a change, I would suggest that we specified two members of the House of Representatives appointed by the Speaker of the House, one from Commerce and one from Children and Family Law. But if the members of this subcommittee don't feel that that specificity is necessary, I don't insist on it. I just make it as a suggestion, and it could be as simple as an informal suggestion to the speaker.
That's not uncommon, right, to specify what, where members on a particular study committee should come from?
No, they do specify sometimes, and sometimes they don't.
Okay.
But this one seems particularly to be outside of the Health and Human Services bailiwick. The Children and Family Law tend to deal with juvenile justice matters and juvenile protection matters, and the Commerce Committee tends to deal with insurance matters. And I have seen Mr. Fox spoke of a whole bunch of stakeholders, and I have seen very, very effective small committees that have assembled all of the relevant stakeholders in front of them and taken their testimony and their input. So I don't see the need for a gigantic commission, which is nowhere near as nimble as a committee and will take much longer to set up. I think we should keep this structure and either leave it as it is or be slightly more specific.
Okay. Representative Cushman.
Thank you, Mr. Chairman. I'm in total agreement with you, Representative Weber. I don't think we even need an amendment. I think if we, even put it in a report that we recommend, once the bill comes out of the full committee, that those two members, that's completely appropriate.
Thank you.
Thank you. Representative Nattaratham, any comment?
I'm in agreement with what has been said. Thank you.
Okay. Representative Weber.
I would make a motion. I would make a motion if you're ready to receive one, Mr. Chairman.
Absolutely.
I would move that this subcommittee recommend ought to pass on Senate Bill 236 and make that recommendation to the full committee. And along with Representative Cushman, I recommend that we put in our report that the committee recommends somebody from Children and Family Law and somebody from Commerce. But that will be at the discretion of the Speaker.
Okay, a motion has been made. Is there a second to Representative Nattaratham? Okay, is there any other discussion on this motion? Okay, all those in favor?
Aye.
We don't need a roll call for something like this, do we? Or not usually?
I thought we needed a roll call on
Okay.
the final thing. but,
Okay, all right.
There are only 4 of us here, so.
It's unanimous. Do I need to call a roll?
I think if you just specify that it was, that the members were polled and it was unanimous, if that's helpful. I think we need a record of who was here because Representative Tellez is not.
Sure, yeah, and I've been making some notes here. So you'd use the full committee sheet, I guess? That's the only,
I think that if you just want to write in your notes that
okay, all right,
the 4 of us were present and all 4 of us voted yes.
okay. Okay, excellent. So again, the record will reflect that the subcommittee is unanimous in its vote on moving ought to pass on Senate Bill 236. Any other discussion or any other business to come before the subcommittee relevant to this bill? If not, I will close this hearing. I will close this meeting. Again, thank you to our the folks in the audience for attending this morning, and thank you for your input. And we're adjourned.
Thank you for being